Namaskar everyone. A very warm welcome to all of you joining us today for this important webinar, Swasth Nari Sashakt Parivar. Together for our health, together for a stronger nation. We often say, when a woman is healthy, the whole family is healthy. Women are the backbone of our homes, communities, and indeed our nation. Yet their health is often the most neglected. This very thought is what inspired the national campaign Swasth Nari Sashakt Parivar, launched today by Honorable Prime Minister Shri Narendra Modi ji, to reaffirm that women's health is not just a personal matter but a national priority. Today's session is our way of strengthening that call, bringing together leaders, doctors, and community partners to discuss how we can turn this vision into reality. Today, we come together not just to talk, but to reimagine how women's health can truly become a national priority. Before we begin, I would like to share a special video message on the launch of this campaign by our Honorable Prime Minister Shri Narendra Modi ji. So, this campaign Swasth Nari Sashakt Parivar is more than a slogan. It's a movement to ensure that every woman, whether in a city, hospital, or a rural village, has access to the care, dignity, and support she deserves. Before we dive into our discussions, it's my privilege to introduce the distinguished speakers who bring with them a wealth of knowledge, passion, and commitment to women's health. Dr. Shri Bajaj, founder director of Ujala Cygnus Healthcare, a visionary leader whose tireless work has brought quality healthcare closer to underserved communities. He will be delivering keynote address and setting the context for today's conversation. Dr. K. Madan Gopal, Advisor in Health, Public Health Administration at the National Health System Resource Center, Government of India, as our guest of honor. He brings deep insights into national health policy and will highlight the significance of this campaign, launched by our Honorable Prime Minister in shaping healthier families and stronger nation. Dr. Narendra, Managing Director of Ujala Cygnus Rainbow Hospital, a renowned name in women and child health care. He will share on-ground perspectives, the critical importance of preventive care and early intervention, and success stories that inspire hope. Dr. Dipali, Deputy Country Head at Noora Health, an organization that has redefined how families can be partners in care. She will take us through the Care Companion program and how empowering families with knowledge and skills can truly transform healthcare outcomes for women. Together, these leaders represent the perfect blend of policy, practice, innovation, and compassion. Exactly what we need to build a future where Swasth Nari means it's Sashakt Parivar. To set the tone of this conversation, I'm delighted to invite Dr. Shri Bajaj, Founder Director of Ujala Cygnus Healthcare, who has been a tireless advocate for equitable healthcare access. Dr. Bajaj will deliver the keynote address and share his vision for this campaign. Over to you, Dr. Bajaj.
Namaskar and good day to everyone. I'm really honored to open this very important discussion on Swasth Nari Sashakt Parivar, and in the presence of such esteemed panelists, Dr. K. Madan Gopal sir, who we always look up to for guidance and for the big picture, for the larger country situation. Dr. Narendra sir, as you said, one of the biggest names in women's health across not just India but all of the global south, and he has been leading the campaigns for women's health all across the world. Dr. Dipali Thakur from Noora Health, and of course you. And you all, I'm sure, will enrich today's dialogue. And it's a very auspicious day to be doing this 17th September. It's our Honorable Prime Minister's birthday today. It is the World Patient Safety Day today, and also, if all of us remember, a few years ago, this was the day on 17th September when we had the world record of the largest ever number of vaccines administered on a single day. We had more than 2.1 crore vaccines delivered for COVID prevention on this day a couple of years ago. So I think it's a very auspicious day to flag off this campaign today. And the discussion we are having today is not just a webinar, it is a call to action for all of us working at the intersection of women's health, family well-being, and community resilience. Even though we all work in the small towns, in the villages, on the ground, but we know that women's health indicators still reveal deep inequalities. Maternal mortality has decreased significantly ever since we started training, but yet India contributes to nearly more than 10% of global maternal deaths, with rural women obviously being at much higher risk compared to urban counterparts. Anemia is a big issue affecting more than 1 in 2 women of reproductive age. So I hope all the women attending this webinar will go back and get their hemoglobins checked, because there is more than a 50% chance of you being anemic, which obviously limits productivity, immunity, and pregnancy outcomes. NCDs like hypertension, diabetes, cancers of breast and cervix are rising sharply, but late diagnosis and poor management remains the norm, especially for our rural women. And let us not forget the invisible mental health crisis: postpartum depression, domestic violence, silence around women's emotional well-being. All these things are not just statistics; they represent our mothers, our daughters, our caregivers, whose health directly determines the health trajectory of all families and entire communities. And this is why Swasth Nari Sashakt Parivar is so critical. It reframes women's health not as an isolated concern, but as the backbone of family stability and national development. And at Ujala Cygnus, through our Sehat Chopals in small town villages, we have seen that women, when they receive preventive care, whether it is antenatal checkups, whether it is cancer screening, or even basic nutritional counseling, the benefits ripple across generations. And we also have evidence for this across multiple published papers, that for every rupee invested in women's health, the returns in terms of family well-being, reduced healthcare costs, and increased productivity are manifold. So I think as we start this discussion today, let us focus on some urgent calls to action. One is, of course, what we have been doing all our lives: access and affordability. So we need to expand decentralized, affordable healthcare in Tier 2, Tier 3 towns, aligned with government programs like Ayushman Bharat, so women don't have to travel hundreds of kilometers for basic care. Second is awareness and agency. So we need to invest in health literacy campaigns that normalize conversations around menstrual health, mental health, and reproductive rights. Empower women to make healthcare decisions for themselves rather than depending on the men in the family, which has traditionally been the norm for the last many hundreds of years. And then integration and innovation. Integrate women's health into family and community programs, nutrition, child health, elderly care, and use digital health tools, teleconsults, wearables, etc. Use as much technology as possible to break the barriers of distance as well as stigma. I truly believe this is not only possible, it is essential if India is to achieve universal health coverage by 2030 and be the Vishwa Guru in healthcare by 2047. We need to harness the power of our demographic dividend. So let us remember that Swasth Nari is not only a healthier woman, she is a healthier woman along with a stronger family, a stronger community, and ultimately a stronger India. Thank you very much for having us all here, and thank you very much for kicking off this very important campaign. Really looking forward to the activities over the next 15 days till Gandhi Jayanti, and looking forward to all of us getting together on 2nd October once again to see what has been done and what are the things we need to do over the next few months.
Thank you, Dr. Bajaj, for sharing such inspiring words with us. Your perspective has given us both direction and encouragement, laying a strong foundation for the discussion that will follow. We are grateful for your leadership and for reminding us why the collective efforts are so important. Carrying this vision forward, we are honored to have with us today Dr. K. Madan Gopal, Advisor in Health, Public Health Administration, National Health System Resource Center, Government of India, as our guest of honor. Dr. Gopal has been at the forefront of shaping public health policies for our nation. He will be sharing his thoughts on the importance of this campaign and how initiatives like this align with India's broader healthcare priorities. Over to you, sir.
Thank you, Vandana, and it's good to hear Suchinji once again. And I'm from the field because today the launch was there. So I was the nodal officer for one of the states. So I'm in the field. So just for this program, I came back to the hotel and I'm connecting so that at least the message and other things can be very clear on that. So one thing, first of all, we know that it's a very auspicious day. Our Honorable Prime Minister birthday is there, and we have witnessed lot of many events happening in the past also, as you have mentioned about 2.1 crore vaccination jabs in one day. That's the world record. So that's it's not records, but today also in his speech, what he has mentioned that if a woman is healthy, whole of the family is healthy. If the woman is not healthy, then you can think of the health of the family. As a common saying is that if a woman is educated, whole of the family is educated. If the vice versa, if man is educated, only the man is educated. So that's the kind of thing. And the message is very loud and clear that we have to at least focus on the 50% population, that is the half of the population is women. And if they are healthy, whole of the family would be healthy and whole of the nation would be healthy. And as you have rightly mentioned, Suchinji, that the demographic dividend which we are having, that can be only made more productive if women are happy and women are healthy, so that they can be more empowered to bring out their family in the forefront and take care of them. With this, I will share a few things what we have been doing in this fortnight. It's not that only fortnight will only give an impetus to the direction in which the activity should go, in which we will be observing many things. We will bring the things in a mission mode so that it can be sustained and continued beyond the fortnight as well. So with this, I will be sharing my screen. The expectation is very clear that we need to saturate the services which are already been providing. It's a joint effort of the Ministry of the Health and Family Welfare and the Ministry of Women and Child Development. But we have to remember that it's a landmark health initiative which has been launched today from Dhar, Madhya Pradesh, wherein apart from the health aspects, many other things have been launched. The PM Mitra Park was there, and as well as the PMSY beneficiaries were also been given inclusion benefit through. More than that, it's a shared commitment to the women's and child health. That's more important. Apart from that, you should start that when I was working in Niti Aayog at that time also it was envisaged that we should be having a mission. At that time it was started, a National Nutrition Mission was there, Poshan Abhiyaan was started. In this Poshan Abhiyaan, for every year during the month of September, they celebrate the Poshan Ma. So that during this month, there has been a lot of focus on the nutrition and well-being of the children. And a lot of efforts are being made to create awareness regarding nutrition, to see that the saturation of services happen. So this is the 8th edition also of that nutrition Poshan Maha, which we are celebrating today. The overall aim of this, all the efforts is to strengthen the healthcare services for women and children across India, so that they can have better access, quality care, and increased awareness. If you talk about the access, as Suchinji has been always been a advocate for talking about accessible, affordable care. If you talk about the access, so we have around 1,77,000 Ayushman Arogya Kendra, which are very near to the community. They cater to a population of 3,000 to 5,000. That is essentially 3 to 6 villages they are catering. Below them, as a bridge between the community and this, you are having a Asha volunteer or Asha worker is there. So that kind of access is there, and how we can leverage on that access so that a quality of care is brought to this. You see that though we have been able to reduce our maternal mortality ratio to around 90s, 97, to be precise, or less than that. But still, it's a pity on us that the women are dying of pregnancy and pregnancy-related causes. Pregnancy is a physiological process which needs to be celebrated. It's not that we should be only talking about the mortality associated with that. Anything which is natural, which is physiological, that needs to be celebrated rather than becoming a pathological thing. So we have to see that how we provide a good quality of care so that the women, they celebrate the natural things, we can celebrate. Besides that, there are a lot of awareness things which are required. The anemia which you are told about. The NFHS 5 data has mentioned that how many women are anemic. We have to see that they have been taken care. If the woman is anemic, they are not able to work properly. Even if men are anemic, they are not able to work properly. There are other symptoms associated, but the awareness regarding and surrounding that symptoms is quite limited. And the moment you try to screen the population, even in your hospital, if you screen women, you will find that around 40-50% of the women would be anemic. We have to address that issue so that they can also enjoy the other well-being and the other things. Besides that, if you look at the scale of the implementation which the government is planning, so we would be in the fortnight, we would be having more than 2 lakh camps. It's not a small number. You think of the numbers that so many camps would be happening, and in which all the services will be provided. We have been providing services across our platforms in the public sector, but you see that the scale in which it is, so that a more focused approach would be there. It can lead to building of awareness and other things. Do you see that we are trying to bring in all the governments, a whole government approach, which we have witnessed during the COVID times. COVID times, had it been only one department or one ministry, you could have thought of the consequences. Here also you see that whole of the government is involved, right from the Women Child Department, Ministry of Health, the other ministry, Panchayati Raj Ministry, Urban Department, the Education Department, other ministries are also involved. And now we are trying to rope in the civil society organization, the private sector, so that we are all working for whom? For the citizens of the country. So you have to have a whole government approach, not that this is your work, this is not my work. You have to collectively work together and see that this. Besides that, the whole of the society convergence has to happen for a particular cause. That's why I'm very glad and happy to see when when the campaign was launched. See the spirit and the vibrations of the people, because all were connected on two-way link by NIC. So I could see the vibes and other things, and that show that whole of the government, how they have conversed for a particular activity. Besides that, the central government institution, the ESI network, the CGHS network, and the private sector, they're also participating now. It's a very, very big event, and we should see that how we celebrate and make it a very, very big success for that. You see that we are having the health camps. As I mentioned, the Ayushman Arogya Mandirs are there. We are having around more than 1.7 lakh Ayushman Arogya Mandir. Primary health centers, around 31,000 are there. Community health center, around 7,800 community health centers are there. And district hospital, around 780 plus district hospital. And talk about the medical colleges, it would be around 780 plus. And tertiary care hospital and the other institutions are also there. Besides that, you talk about the 70,000-80,000 odd private sector hospitals and the institutions. See the number of which, if everybody works together, they plan together, see that how the whole of the society will be converging for a particular cause, that is women's health, and how we can empower women and see that the empowerment can lead to empowerment of the families and empowerment of the society and empowerment of the nation and society. If you talk about the screening thing, that in the CHC which I visited today, a lot of things have happened. They start with the registration of the women, the counseling is there. After registration, their body mass index is taken. Then after that, the BP and other things. There's a seamless thing where screenings happen. After the body mass index is taken, the BP is checked. After BP, the hemoglobin is checked. After the hemoglobin, the blood sugar levels are measured. Then after that, for any tropical disease like malaria and other things, it's also screened. After that, the screening for the cancers and the mental ailments also take. After screening, the primary thing, you do have specialists also. Immediately in the hospital vicinity, the person is referred to a specialized care. If somebody requires TB screening, they will be sent for TB screening. Somebody required for dental screening, they are sent for dental screening. That kind of thing is there. But essentially, we are focusing on the NCDs among the women, that is hypertension and diabetes. Screening for hypertension, diabetes, early detection is crucial for management of this. If you are able to detect this diabetes and hypertension early, then you are able to put them on treatment, and the treatment can be followed up. And remember, we have to remember that the screening of the patients or the women in any of the government institution is free of cost. And subsequent to that, for the continuation of treatment, the medicines and other things are also provided free of cost. Besides that, the other thing which we are screening is for the oral, breast and the cervical cancers. So screening for oral cancer, breast cancer, cervical cancer, though regular checkups are happening, but this is an opportunity where they are being registered for screening more aggressively, so that at least we know that which are the women which will be requiring a higher level of care. After this camp screening, I think if they require some more follow-up or more treatment, they will be connected with the respective specialties for the treatment of this. The other thing, as I mentioned, I've shown you that how the CSC, the place where I have witnessed this launch of the program, that was a seamless thing. That was one other thing which we are doing is the anemia screening. That is screening counseling for adolescent girls, women, as well as addressing the nutritional and deficiencies which we encountered during this. That is also happening in this camp. Besides that, as I mentioned, that if the person is having the symptoms for tuberculosis, like cough for more than 2 weeks duration, the weight loss and other things, they are screened for tuberculosis. And any of the vulnerable women or the children, they would be just put to that particular facility, and their sputum would be collected and they would be tested. And if they are positive, they would be put on treatment as per the routine things. Besides that, you see that how the early diagnosis and that can at least prevent the spread to their families and other things. Another important screening which would be happening is the sickle cell disease. The screening is there. Besides that, as you have witnessed today, that means 1 crore card, because last time when from the shadow Honorable Prime Minister has launched the sickle disease elimination program, wherein the first card was issued. Now the 100, this 1 crore number card was issued to a beneficiary there. So apart from the distribution of cards, counseling in the tribal area, the genetic counseling and support. Besides that, there are many other things which are happening in the sickle cell area. In the maternal and the child health services, you say that we are focusing on the antenatal care, the documentation, the immunization, and the routine kind of thing, postnatal support. The counseling and other things will be following. But if a specialist requirement for gynecology, dermatology, and psychiatry is required, their specialist camps will also be organized. Besides that, as I mentioned, that it would be a Nishchay Mitra enrollment drive to expand the pool of the Ayushman, this Nishchay Mitra. Besides that, My Bharat volunteers would be mobilizing the people, so that our goal at our Honorable Prime Minister has set in the goal. That means we should be eliminating by 2026. At least we move towards achieving that goal. The non-communicable disease, as I've already mentioned, that we are trying to see that how the risk pooling and referring for early interventions can be instituted. Besides that, in these camps, you will be finding lifestyle, diet and nutrition, regular physical activity, tobacco and substance use. And another thing which we have been trying to focus in this workshop and these camps is reduction in the consumption of oil and the sugar, as our Honorable Prime Minister already given a clarion call that we should try to cut off our sugar intake and this oil intake. Besides that, the Ayush Ministry is also collaborating. In some of the area, they would be demonstrating the yoga sessions, the Prakritik Association, the Ayush treatment for antenatal, and plus distribution of the home remedies that would be there. Apart from this, any of the good events, we usually celebrate it by donating blood, because that's the only great gift which we can give. Along with the camps, we would be having this National Blood Donation Initiative, and it's a mega blood donation blood collection drive to strengthen trauma care, surgical process and treatment of this. One would be wondering, see, so many bloods would be collected. We would be collecting only that number of bloods which are required, which can be consumed. The others would be registered as donors, and as and when required, they will be called for voluntary donation. It's not that there should be a misconception. There would be a misconception saying that what will happen, so much wastage would be there. There won't be any wastage, because wherever blood is required, they will be collecting as per the demand. And anybody coming for blood donation, they would be registered as voluntary blood donors. And as and when required, they would be called in the subsequent camps. Okay, so you see that there is a common saying that so many blood would be collected, but very consciously we would be only registering the donors in case blood is not required. So we won't be taking their blood. Apart from that, we are trying to focus on the awareness and the behavior change activities. The community transformation initiatives will be taken during this campaign. So health education sessions on menstrual hygiene and nutrition, then nutrition counseling sessions for community members, lifestyle modification, reduction in cooking oil through, which I already mentioned, community mobilization, engaging grassroots workers for community transformation. Next, please. Besides that, we are trying to, there would be a stall for
this upgradation of Abha ID, because we are trying to go for digitalization of services. The beneficiaries will be enrolled under the PMJ, Ayushman, Vyaya Vandana and the Abha ID. But today also we could see all the 3 counters were there and they can be registered for this. Besides that, apart from creating the cards for them, there would be distribution of the Ayushman, Vyaya Vandana cards and the Abha cards. The help desks are also been created at the help desk for helping this. Besides that, next please. Besides that, we are trying to see that how the private sector, not the private sector thing, how the private sector is expanded, because nowadays the collaboration is the key. So we are collaborating. I think round of meetings have happened at the central level with FICCI, CII, private organizations and everybody. We are seeking the collaboration so that the e-reach also expands. See that how the private sector can also endorse through the objectives so that the Abhiyaan access reaches and it have a desired impact which it needs to have. Besides that, we are trying to see that how the private sector can help us in maintaining service standards across all the sectors in this. Next, please. Anything is not possible. Everything is not possible unless you make it a people participation. It's a good example of people participation. As I mentioned that it has to be whole society, whole government approach. And one of the example is how the community is mobilized. Yesterday when I was in one of the place, so what has happened? 3 days before, all the churches were been told that they have to mobilize their people. The school volunteers they have gone to the school to mobilize the school people. Then the community health volunteers there. Besides that, the ward members are there. So it's not only one person effort, and as a result, all of the people they used to come in this. We have to see that how our key stakeholders in this mobilization, the ASHAs, ANM, Anganwadi workers, they can help us on the ground root program, and they are already doing this thing. Besides that, there are self-help groups, Panchayati Raj institutions, and urban local bodies which can help us with this. And there are people representatives who are there, and we have to do this. Apart from that, at the central level, we are having a media strategy, community IC, progress tracking, national portals are there, the transparency is there for it. Next, please. The implementation challenges are there. Next, please. The implementation challenges are, that means how the state and the UTs can help. So these are the things which are, the coordination is happening at the leadership level. Then the inaugural events, I think you have seen how beautifully the inaugural events are being coordinated across the countries. There is an active involvement of the Lok Sabha members and the Rajya Sabha members. A coordination has happened. For all the places, you have the state nodal officers as well as the central nodal officer for the particular state. I'm one of the central nodal officers for one of the states. Then the mass participation is ensured through large-scale women participation and other things. And besides that, next please. There has been a convergence of across all the ministries, Ministry of Women and Child, Rural Development Department, Education, Youth Affairs and Society, Tribal Affairs, Social Justice Empowerment, other ministries like Defense, Labour, Ayush, Heavy Industries, Home Affairs to run rural health camps by their medical institutions. That means with the whole government approach to this. And what we are expecting have outcome with this, we have to see that how the access is enhanced throughout this so that awareness is there. Early detection can improve the NCD and cancer screening. There is a family empowerment which can strengthen the health systems. Then the behavior change will at least lead to sustainable health lifestyle changes and a mass movement for health awareness. If a Jan Andolan, as our Prime Minister has been always pushing for, all the things can be achieved through Jan Andolan. And let's see that how the light which is ignited today for making a mass movement for women's health, empowerment of women. Let's collectively see that how we can take this forward. The health and empowerment of women is central to progress of all families, communities, and the nation. I stop here. Thanks once again for this opportunity to share my thoughts and views. Thank you very much.
Thank you so much, sir, for taking out of time from ground zero and joining this session and giving your deliberations to this and bringing forth the policy perspective and articulating the larger vision. Your address has helped us connect today's discussion with the broader national vision and context, reminding us of the importance of aligning our efforts with the overarching goals of public health and sustainable development. Thank you so much, sir. Before we move forward, I would like to share a special video message on the launch of this campaign by our Honorable Prime Minister Shri Narendra Modi ji.
जब सेहतमंद होगी हर नारी, तभी संपूर्ण होगी विकसित भारत की तैयारी।
माताओं, बहनों, बेटियों, उनका जीवन पीढ़ियों को प्रभावित करने वाला, पीढ़ियों का निर्माण करने वाला जीवन होता है। एक बेटी का सामर्थ्य, उसकी शिक्षा, उसका कौशल सिर्फ परिवार ही नहीं, समाज की, राष्ट्र की दिशा तय करती है।
माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी की प्रेरणा से महिलाओं के अच्छे स्वास्थ्य के लिए शुरू हो रहा है देशव्यापी सघन अभियान स्वस्थ नारी सशक्त परिवार, जिसके तहत देश भर में स्वास्थ्य शिविर लगाए जाएंगे। साथ ही महिलाओं और बच्चों के पोषण को इस मुहिम से जोड़ते हुए 8वें पोषण माह की भी हो रही है शुरुआत और प्रधानमंत्री मातृ वंदना योजना में आवेदन करने के लिए चलाई जाएगी विशेष पंजीकरण मुहिम। अधिक जानकारी के लिए करें अपने नजदीकी आयुष्मान आरोग्य मंदिर, सामुदायिक स्वास्थ्य केंद्र, सरकारी अस्पताल और आंगनबाड़ी केंद्र से संपर्क। स्वस्थ नारी सशक्त परिवार, यही है विकसित भारत का आधार।
Thanks, Raul, for sharing this. So, as we all say, that this is more than a slogan. It's a movement to ensure that every woman, whether in a city, hospital, or rural village, has access to care, dignity, and support she deserves. Now, let us turn the ground realities. What happens when policies meet people? What challenges do doctors and families face every day in ensuring women and child health? For this, we have with us Dr. Narendra, Managing Director, Ujala Cygnus Hospital, a renowned voice in women and child healthcare. Dr. Malhotra will walk us through the on-ground challenges and opportunities in women and child health, why preventive care and early intervention are absolutely vital and real-life success stories. Over to you, Dr. Malhotra.
So very good afternoon to all of you. Thank you very, very much for inviting me here to share some of my views. So at the outset, Swasth Nari Sashakt Parivar Abhiyaan. On this occasion, we first would like to wish a very, very happy birthday. जन्मदिन की बहुत बहुत शुभकामनाएं हमारे आदरणीय प्रधानमंत्री नरेंद्र मोदी जी को, और आज उनका 75वां जन्म दिवस है. And he has asked us all to pledge for a healthy woman, healthy family, and a strong nation. And this painting you see is made of glass and gold paint in America, in New York. And when I went to New York, an NRI couple gave me this to deliver this to Modi ji on his birthday. So we have sent him this last month, and I hope he has liked it, and it will be there in the museum or for auction of all his gifts, as you can see. So this painting has come from America. Now let's see, what is this Abhiyaan? What has he actually asked us for, and what is exactly is expected out of us as a medical healthcare professional dealing with women or with anyone. And let us see how we can join hands with the public sector, the private sector, the NGOs, and bring about a change in our nation's health. So at first, what I understand from this Abhiyaan is we need to prioritize women's health, which will be a cornerstone of the family and for national well-being. We all know, teach a woman, you teach a family, and you teach a family, you teach the society, you teach a society, you teach the village, and you teach a village, you teach the district, and finally the nation gets empowered and educated. So inspired by this emphasis by our Prime Minister Modi ji, that focus on preventive health and women empowerment. And I believe that women empowerment is still lacking. Though we have educated our women, but they are still not safe and empowered as it is. And we'll come to this. So I feel that women problem are WEEP, WEEEEP. So my WEEP has 4 E's. The first is education, which we have conquered. The second is employment, which we have conquered. The third is environment in which she is working or existing, which is still lacking. And last, empowerment, which is still lacking to our desired thing. So the 4 E problems of women, which is we, has to be tackled by all of us. And it is just not a medical problem. It has to be a socio-medical economic problem, which all of us have to address to give a healthy woman, a healthy family, and a strong nation. A lot of people ask me why you want to focus only on women's health. Well, because women are right now as a high burden of anemia and malnutrition. If you see in a village or in an old setup, it is the lady of the house which eats last. When the food is made, she'll first give it to her husband, then give it to her in-laws, then give it to her children, and the last little bit which is left, she eats. Sometimes it is not left at all. So that is malnutrition is a major problem, and hence there is anemia. On the other hand, India is facing another epidemic, and that is obesity. So 20-25% of our adolescent and children are getting obese because of the junk food, because of not right nutrition, and hence they are causing a genetic disease like PCOS flare up. So the epigenetics is a problem, and that PCOS is a problem, and also causing a lot of infertility problems, which could be due to anovulation and male infertility, dietary, smoking, habits, all that. The next problem with these women, why we have to focus, is the menstrual health gaps. Still, menstruation is considered as a taboo, and they use very dirty pads and very bad hygiene during menstruation, not allowed to cook, not allowed to go in the kitchen. So social taboos are still there. So we need to have a huge menstrual awareness campaign at the school level, college level, and even at the adult level in the villages. And I believe there is a scheme run by the government where the sanitary pads are provided at the cost of 1 rupee. Fantastic. And there are some NGOs which are doing reusable sanitary pads which can be washed and used again and again. So these are the kinds of interventions which are needed to have a good menstrual hygiene program running. Then we have still the challenge of maternal mortality, as someone said, Dr. Bajaj said. Well, we are right on track. As of today, the Indian maternal mortality has come down to 88 per lakh. But there is a disparity in states. While Kerala shows almost down to 10, Tamil Nadu down to 20, it is the states of Uttar Pradesh, Jharkhand, Bihar, which are still in hundreds. And that is what the focus needs to change. It needs to change in the states where it is required more, and simple interventions like building roads, building connectivity, awareness of institutionalized delivery, Janni Surakshi Yojana, Pradhan Mantri Surakshit Matritva Abhiyaan, all these needs to be taken to the ground level. Now, probably the government machinery is unable to handle such a big load. So this should be passed on to the private sector, and the private-public partnership will play a major role in bringing down the maternal mortality to below 70 by 2030, which is the SDG goal. Then we need to make women aware that they should not neglect their own health. That is another major problem. So awareness for women's health to women to look after themselves. If they look after themselves, then only they'll be able to look after their family and look after the society and make a healthier nation. So investing in women is a multiplier effect. You will multiply if you invest in women's health. How do we do it with this Abhiyaan now? Well, we need to promote preventive health checkups. And you can see today a massive initiative of a free health checkup all over India. And I believe it is going to be creating huge records which will never be broken on the amount of women which are going to be seen, examined, consulted, ultrasound, tested today on just one day of 17th. And we will remember the 17th September vaccine jab when we made a world record of giving over 2 crore vaccines on a single day all over India. So these are the kind of initiative, but it should not be only once a year, maybe once in a month. So we did, when I was the president of FOXI in 2008, we did with Sushma Swaraj, started the Vande Mataram scheme. Every pregnant woman will be seen free of cost at any center, including a private center, including a 5-star hospital, free of cost on 9th of every month, just one day. So our FOXY members, which are about 48,000 gynecologists in India under our association, one day they see free. You see the amount of coverage we'll get for preventive checkups. Then we need to ensure that we get the nutritional security online across all life stages. So intrauterine, from what I call as womb to tomb. So look after the nutrition of the girl child, womb to tomb. When she is inside the uterus, when she is born, when this girl is growing up, when this girl reaches adolescence, when this girl reaches puberty, when this girl is pre-pregnancy and adulthood, when this girl is pregnant, when this girl is post-delivery, and when this girl is perimenopausal, and when she is menopausal. Across the life stages, the nutrition has to be addressed and a nutritional security be provided. Then we need to strengthen the maternal and the reproductive health. The maternal health is very important, and diseases like anemia, diseases like non-communicable diseases, diseases like polycystic ovary, diseases like endometriosis, which is about 25% of women, and we are not even looking at such a dangerous, painful disease, and just painful periods are ignored. So that does not need to be ignored. And a lot of infections, pelvic PID, chronic cervicitis, cancer cervix, cancer breast, all these come in maternal health, and we make our women healthier. Then, as again it was mentioned before, mental health is today the most important thing, and we see a lot of depression. When I was a student, the medical book, which we read in our medicine, the depression was just one paragraph. Today, depression in that same textbook is 25 pages. See what has happened to this. So that needs to be changed, and we need to be very, very addressed towards mental well-being. All this will happen when we can create awareness through mass campaigns, and not by just doctors, by NGOs, by clubs, Rotary clubs, Lions clubs, Mahila Sanghs. Everyone should get together. What is my and your role, or what we call as the role of doctors? And here you see some of our pictures of actual work which we have been doing in Agra. Every day we organize a health chopal in the villages, nearby villages, and see hundreds and hundreds of patients, male, female, whatever, and counsel them and make them aware. We do school programs, school checkups, school awareness, school lectures, quiz in the schools, special camps for women. This was done with the Gurudwara at the, and you see thousands of women came in it. So conduct regular health camps and screening. And we have had a lot of debates on this, that nothing should be done free, but I am still on the belief that we need to do these health camps and screening camps, at least to get them out. Provide counseling on their lifestyle. So lifestyle, nutrition, contraception, exercise, yoga, meditation, mental health, everything. Lead all the awareness drives in the schools and in the communities, and collaborate with the Ayush and the other health sectors. Very, very important. We cannot just say the Ayush are not a part of allopathic medicine, so they should be ignored. No, they can be used for counseling and for basic workup very, very effectively in our health system. What are the role of my professional organization? Now, I have been president, and Dr. Jaydeep, both of us have been president of 7 national organizations and 3 international organizations, and we are still heading as vice presidents of 2 international organizations. So IMA, Indian Medical Association, with over 1 lakh of doctors, Federation of OBGYN Societies of India with 48,000 members, NNF, Indian Pediatric Association with 40,000 members, nurses associations, NGOs, all should get together to run public awareness programs, develop training modules and workshops on life-saving systems, CPRs, basic training, how to handle anemia, how to detect anemia, what to do, and we should partner with all the government outreach programs. That the government has to come forward and say, yes, we want private practitioners to come forward and partner with us in all these programs which are there. And this could mobilize the doctors nationwide and make a major, major effect. What are the special initiatives which are there? There is Beti Bachao, Beti Padhao, and I'm humbly express to you that this was first given by our Foxy Federation in 2008 when I was the president. And my beti or our beti had this girl with 7 color ribbons, as you can see. And each ribbon was a problem which this girl faces. Anemia, PCOS, cancer, breast diseases, PID, sexually transmitted diseases, and the vaccination. And that is how we addressed that Beti Bachao, Beti Padhao, make a new woman, a healthier woman. Educate, prevent, and eradicate. Only you can make a difference. We thank our Honorable Prime Minister for taking this up as a national slogan in 2014, given by Foxy. And we proudly say that this comes from the gynecologist of us. Then, of course, Swasth Nari Sashakt Parivar is right now the Nara. You can see the mobile vans which go out in the villages. Again, when I was student, during the time when Shri Narayan was the health minister, we had these huge mobile vans where we went and operated on people in the villages. So something like that again can be done because now the roads are accessible. That time the roads were poor. Awareness through social media. Everyone should put a reel on Instagram, Facebook, social media every day and give a slogan every day on the radio. FM radio is heard by everyone. TV is there in everyone, local channels, everything. And we need to integrate all the national health mission schemes and take them to the women so that we get a Swasth Nari. What will be our indicators of success? Well, we will pick up anemia, reduce the anemia. We cannot eradicate it. We will reduce the maternal mortality rate. We will reduce the neonatal mortality rate. We'll improve the nutrition. We'll improve the maternal health. And we will make people more aware of cancer and cancer vaccinations. And we will hence have greater participation of women in decision making. So what is my last message is call for action. And just recently in a presidential conference in Kanpur where I was speaking here, I addressed this in front of the 14th President of India and Shrimati Anupriya Patel, who are Deputy Health Minister, that what we need to actually do. So doctors screen and counsel at least 75 women in 75 days, 1 woman a day, each doctor. Organizations should adopt a community, a local community or a village, and do for women's promotion. The public who are listening, encourage every woman that she should prioritize her health first. Like it is in the plains, put your mask first and they'll help others. And the slogan Swasth Nari Sashakt Parivar, a strong India at 75 and beyond, is what we are aiming at to make a strong India and a Vikasit Bharat by 2047. We pay tribute to our Honorable Prime Minister Modi ji on his 75th birthday and gratitude for his vision for a woman-led health development healthcare mission which he started today, and would the Poshan Abhiyaan, the Ayushman Bharat, the Beti Bachao, Beti Padhao, and now we should add Beta Samjhao in this program, as you can see, which we have done since 2018. So these are what are some of my new views of what we should be doing and what the doctors and the community should be attempting to do for bringing a healthy woman and a healthy Swasth Nari and a Sashakt Bharat. Thank you very much for inviting me to express some of my views.
Thank you so much, Dr. Malhotra, for reminding us that behind every policy and program are real people and their resilience. You have given us a deeper understanding of the opportunities to make a meaningful difference. Your perspective adds both authenticity and inspiration to this dialogue. From the hospital setting, let us now move on to the community, where families themselves become caregivers and partners in health. We are privileged to have with us Dr. Dipali, Deputy Country Head from Nura Health, who will be talking about their Care Companion program. This program turns family members into health allies, equipping them with knowledge and skills to support mothers and children at home. It is a powerful reminder that care doesn't end at the hospital door. It continues in the home and in the heart of the family. Over to you, Doctor.
Thank you so much, Dr. Vandana. Namaskar sabhi ko. Respected guest of honor, Dr. Madan K. Madan ji, distinguished speakers, Dr. Bajaj and Dr. Malhotra. Thank you so much. I don't know if I'm going to do justice talking after you all, after those amazing, inspiring speeches, but I'm grateful for the opportunity and privileged to be here. I'm Dr. Dipali Thakur. I'm the Deputy Country Director at Noora Health, and I stand here representing a passionate group of 400 plus Noorans who come from all spectrums, from all walks of spectrums, right from public health, design and innovation, technology and research. As the nation gears up for this ambitious campaign launched today, Swasth Nari Sashakt Parivar Abhiyaan, I would be sharing a few insights from women's health from my end of, and by the end of my presentation, I'm hoping that all of you will walk away with a broader sense of why this is important. I'm sure speakers before me have already chalked out the way forward and the plan. I just want to still share the why behind it, so that all our people, passionate public health enthusiasts and people part in the healthcare, broader healthcare sector as well, are reminded of certain realities that we are dealing with. If we have to go back a little bit, I know Dr. Madan has also shared, and even Dr. Malhotra, India's progress through healthcare indicators. We've come a long way. In 1947, if a child was born, he or she would live only 23 years. In 2022 itself, this rose significantly to 70 years. That was the life expectancy. And today it's at 72 years, which is just 1 year short of the world's life expectancy, which is pegged at 73.4 years. This is remarkable, and it's not just in life expectancy, multiple indicators of health. This is just a snapshot. This slide is just a snapshot. There are multiple things that can be covered over the years, but there has been a slow but it's very steady progress, which was made possible due to the clutch of policies. Dr. Malhotra just now shared a bunch of them, specifically targeted to improving access to healthcare services of people, bringing in cutting-edge technology and research to the practice of medicine. We also saw this rise for a parallel healthcare system in the private realm, which was also a big boost. In the 1990s and through the 2000s, the discourse of women's health in India centered on MCH, which is maternal and child health. That motivated this was motivated by the country's exceptional high maternal mortality ratio, which still stood at 556 in the 1990s, where the global average was about 385. Time-bound targets were laid down by the National Health Policy of 2017, as well as Millennium Development Goals. If you see on the slide, neonatal mortality ratio has also impacted over the years, and we are now striving for single digits. Those are the targets that have been given by National Health Mission to our respective states. A key response by the government was the flagship of Safe Motherhood program, that is the Janani Suraksha Yojana. This was launched in 2004, which gave a financial incentive to a mother to deliver in an institution. Additionally, this was a true attempt to improve healthcare delivery across rural areas under the National Rural Health Mission. Among its success was ASHAs, a cadre of female accredited social health activists, that is ASHAs. A cadre of female health workers working in the community was created to deliver healthcare at the doorstep and of all services, whether it was immunization, whether it was taking the NC mother for checkups. There are 4 checkups, mandatory, they have to be done. That played a key role, and a bunch of these game changers which were there, Poshan Abhiyaan, Suman program, the Lakshya program, Mission Parivar Vikas also had an impact, and of course Anemia Mukt Bharat. All these together impacted the overall maternal services and reduction of key indicators of whether it was NMR or MMR, and hence, as Dr. has just shared, we've reached a figure of 80 in 2023, just remarkable progress. These initiatives by the government have also played a pivotal role in increasing the number of institutional deliveries, which was one of the major problems. Creating access was one, and also bringing the mothers to these institutions was also another challenge. So today you see around 87% births in rural areas and 94% births in urban areas are all institutional deliveries. This wasn't the case way back, even till 2015, this was a very skewed ratio. As per latest figures, along with this, there was a decline in MMR. As the change happened, healthcare needs also shifted. There has been an epidemiological transition from infectious diseases to non-communicable diseases, the NCDs, causing a change of focus for healthcare needs for women in India. NCDs such as cardiovascular diseases, cancer, diabetes accounted for 53.5% of the deaths among women in 2018, and this rose from 33% in 2000. This evidence indicates that the country has indeed made strides in tackling overall indicators of mother and child health, but there is scope of creative approaches to navigate underlying social context and cultural norms. You can see on this slide, there's a clear demarcation from the table where you have cardiovascular diseases, chronic respiratory diseases, cancers, diabetes, all as a breakdown of the 53%. Now, this is what was happening in India. Let's look at what's happening in the global forum as well for a bit and then come back. There was a report presented by the World Economic Forum and in collaboration with McKinsey Health Institute. When discussing what the report highlighted was, whenever women's health is spoken about, the common rejoinder was that women on an average live longer than men. But this neglected the fact that they spent 25% of their lives in debilitating health. Why is this important? Addressing the gaps and shortcomings in women's health could reduce the time women spent in poor health by almost 2/3. This has the potential to help 3.9 billion women living healthier, higher quality lives beyond the societal impacts of healthier women, including more progression in education and intergenerational benefits. Improving women's health could also enable women to participate in the workforce more actively, resulting in a potential boost for the economy. Hence, this is important. So why is the health being impacted, and why almost at least half of the population is being overlooked? The study highlights that highlights 4 root causes: science, data, care delivery, and investment. Under the science, it says that the study for human biology defaults to male body, which hinders understanding of sex-based biological differences and results in fewer available or less effective treatments for women. There are a couple of well-known cases where women and men experience important differences in uptake of effectiveness of a medicine designed and approved, which is being designed and approved for both. Still, one example would be asthma, which is a common respiratory condition affecting men and women at a similar prevalence rate as well, where acute asthma exacerbations present symptoms like shortness of breath, wheezing, cough, chest tightness. Inhaler therapy with bronchodilators and steroids is the mainstay of treatment, but studies have shown that this treatment is around 20% less effective in reducing exacerbations in women compared to men. Another example is cardiovascular and cerebrovascular diseases, which today contributes to a burden of globally for both men and women, accounting for 16% DALYs for men and 14% for women. A German study found that despite identical technical success of percutaneous cardiac intervention for men and women, there was about a 20% higher age-adjusted risk of death or of cardiac event in women compared to men. Research in women's health primarily focuses on diseases with high mortality, overlooking diseases leading to disability. There is up to a 10-fold higher volume of new therapies in development of some of the most common women's cancer compared to debilitating gynecological problems. Even Dr. Malhotra just now mentioned this, that you have menopause, premenstrual syndromes, endometriosis, polycystic ovarian disease syndrome. The solution is not to trim for funding, but to recognize the possibility for advances in research related to other women conditions like these gynecologies, which does impact the amount of time a person would take away from work or the pain that she's going to go through. Additionally, even maternal conditions could receive more attention, while they contribute to a similar share to overall suffering among women compared to women specific with cancers. There's a larger discrepancy in the pipeline of therapies being developed. For example, even though PPH or postpartum hemorrhage is the leading direct preventable cause of maternal mortality in lower and lower middle income countries, only 2 medicines have been shown effective management of PPH over the last 30 years. Just 2. In all, when tackling women's health, the solution is not to divide more slices of the pie, but it's to make more pie, is the ask. Awareness and prevention is also another aspect. I will not get into the points for data, but and care. In India, I have seen these examples. There were particular studies in Rajasthan where there were barriers of women to even reach the healthcare facility because it's an out-of-pocket expense. I would spend, or the families would spend more for a male caregiver to reach the facility versus a female caregiver. There was another study which showed in South India, one of the leading hospitals for eye treatments, that when men and women show up, the women would have a poor prognosis because they would come so late for diagnosis to a center. This shows that the barrier for women in care delivery as well. On a global scale, there are a lot of delays in diagnosis, initial screening, and suboptimal treatments. Awareness and prevention health education, including even menstrual. Even Dr. Malhotra just now mentioned that even today, menstrual education is a challenge, right? And women around the world who experience conditions such as painful periods, endometriosis, or PCOS, or uterine fibroids have limited awareness. They themselves have very limited awareness of what is normal and when to seek medical advice. Hence, education can also improve all of this information. It could also impact on how this person shows up to school, how effective pain management strategies could be, and hence result in the quality of how this person leads her life. Apart from I'll not go detailed into this slide, but there's another aspect that I would like to touch. The study also highlighted, can you see this round circle here? Adjusting for actual disease burden would place menopause among the top 2 conditions with a GDP impact of $120 billion. Can you imagine? I don't think anyone would have ever thought. I would really urge, it's available free on the internet. Please do have a look at this, especially people who are part of research, part of policy making. Crucial interventions need to be done. The study also highlights that investing in women's health shows positive return on investment. For every $1 investment, $3 is projected in economic growth. There remains gender inequality in healthcare, wide gaps in research and treatment ability for areas that are unique to women. Slow progress centers around deficiency of funding, subsequently a scarcity of clinical research and data on women's health. That's why on the previous 2 slides, you would have seen a data point. Even the study highlights the fact that there is less data to even come to conclusions. Hence, the urge to the policymakers and the researchers at large is to spend on women, on understanding their problems, which are very crucial to particularly women. Hence, by elevating importance of women's health, we can deliver better, more inclusive data and insights, more targeted, accessible solutions, and enable better care for women. I would now like to just take one slide here for climate change, whether we like it or not. And I think this COP28, they've also taken it up as a major bucket that unfortunately the data on this is not there. There was one study which I couldn't find, otherwise I would have shared insights from this for this as well. But rising temperatures, the flash floods, what we've seen, all these are adding to displacement and even airborne, the pollution impact on women, because we have a large women force today, and they're all part of they're breathing the same air, which is impacting them. It is leading to low birth weight, babies. It is impacting to infertility, high rise in infertility cases. And to some extent, there are some studies, and I couldn't find conclusive evidence, and hence I'm not sharing it here. Impact of all of this is also happening to the babies who are born today. Very unfortunate. Hence, it really requires our attention today. I would like to pivot to the work that we are doing here at Noora Health. The intervention that we have brought into the public healthcare system is called the Care Companion Program. We believe that there's a power imbalance in our global healthcare system where those who care most for the patients, that is their loved ones, are left behind in healing. Too often, patients and family members leave the facilities very anxious, confused, and ill-equipped to take care of their loved ones, leading to preventable complications and in some cases even death. Around a decade ago, in 2025, we started with one hospital and we thought, can we do something? What if the family member who's sitting right there next to the patient, can we teach him or her any basic skills so that they could be the first line of care when they go back home? Is it possible? Can we try it out? And that's how Noora Health, at Noora Health, we believe in the power of family caregiving and healing power of the which comes from your primary resource, which is the loved one, and this person is always present in our hospitals. Of course, we allow patient caregivers to be a part. So this is a session of the Care Companion Program being delivered by the healthcare staff, the nurse or the counselor, to in a ward where you can see male and female members seated. So Care Companion Program turns hospital hallways and waiting rooms into classrooms by tapping into the most compassionate resource available for patients' care, the patient's own family. By turning these white family members into skilled caregivers, they make family members an important pathway to the healthcare delivery system and reduce preventable patient complications. Our mission is to improve outcomes and strengthen health systems by equipping family caregivers with skills they need to care for their loved ones. Our model, very simple: identify priority healthcare practices. Now, in a country like India, when you go from even a state, even from adjacent states, when you move from one state to another, all healthcare practices shift. I'm talking about not the medical practice. I'm talking about what is done at home. What does your mother-in-law tell you, or what does your mother tell you when you deliver a baby? What you should do and you shouldn't do. So one thing is to identify priority healthcare practices, and then if there are myths, they need to be broken down. The first step also takes care of bridging the gap where we customize the information that has to be given to the caregivers. Imagine, and please, I'm going to reiterate that we are training the caregiver, the mother, father, father-in-law, mother-in-law, or the sister-in-law who's sitting right there with the patient. And that's an adult who you're trying to teach. He has to unlearn certain things because through generations, they've understood a few things. During this, the information that you have to give has to be simple, broken down, bite-sized information that has to be given, and the tool that you use has to be such that the information is carried by that person in that 30-minute session that they do and is also taken forward. So there has to be an impression on the person. There are a couple of program areas that we work with: maternal child health, MNCH, non-communicable diseases, primary care, which is our Arogya Shri Mandirs, cardiac care, tuberculosis care, and HIV. These are certain tools. I'll go to this slide. So you can see in the front, the person would see only a picture. These decks or these flip charts are made in such a fashion that the patient facing, and you'll see it in pictures ahead, it only has a picture so that the mother or whoever is the caregiver sitting there, they remember that picture, whether what is the right and the wrong thing to do. And at the back, the caregiver, whoever is the healthcare provider, has data about what has to be informed, what are the key behaviors that they need to do, and what are the warning signs that they need to know, and what they shouldn't be doing. The service doesn't, the Care Companion program does not end at the facility. It also continues with them at home. So there is a mobile Care Companion program service, which the person can very easily sign up for, and it is free. It does not cost. There are variations to it. So for example, for NCDs, you would get nudges. Did you take your medication today? Did you go to your doctor? Have you checked your diabetes recently? So tailor-made for every condition area, you will get tailor-made messages. There is also a live support. We've received, every day we receive umpteen number of questions from patients, but we do not do telemedicine. That's not what we do. We are here for preventive measures, for information to be given in simple language to the patient. An example of what the mother would ask was, okay, my breasts are feeling heavy because she's a newborn, she has a newborn, she's a postpartum mother. If it's red, what should I do? So, these are simple things for which sometimes they don't get to go to the nearest hospital or a PHC center. And if that information can be given to her then and there, similarly, it becomes helpful. And you'll see, I'll show you the specs of how many messages are received over a daily basis by our teams. Coverage. So in India, we've implemented the Care Companion program in every maternal and child health facility in 8 states across district hospitals, sub-district hospitals and CHCs. And in a couple of states, that is Andhra and Punjab, we've implemented it at Ayushman Arogya Shri Mandirs, which is the health and wellness centers. The primary care model is in 5 states, Punjab as mentioned. Reach to date 24 million, and this is across. So the Care Companion programs across 4 countries, India, Nepal, Bangladesh and Indonesia as well. Our reach is 24 plus million. We've trained to 21,000 plus healthcare workers, and we've implemented the program in 12,000 plus facilities. This is our WhatsApp reach, 1.3 million, and 2,000, we have 2,000 active users across the 9 states of India. This is how a typical class looks like. This is an ANC waiting area where there is a session being run by the lady. This is a training session in Bangladesh, again an inpatient session. Nutritional counseling. This is the post-cardiac service, the post-cardiac patient, which the mother was taught during her stay at the hospital on how to take care of the patient. Postnatal care, teaching KMC, sick newborn. So all SNCUs under these implementation programs are also running the Care Companion programs. Here we have a longer, of course, the longer the stay, the mother stays for a longer time. So our impact with these mothers is also long. This is the TB FCM model, which was implemented 2 years ago. A session in Indonesia. These are some of our research papers that have been published. 71% reduction in post-surgical complications in cardiac care, 56% decrease in newborn readmissions, 18% decrease in newborn mortality. We've also done, during COVID, we've done 48% reduction in hospitalizations and immunization. We had seen a 35% increase in immunization during COVID-related lockdowns. We are on a mission, Nora Health is on a mission to make family caregiver training as a standard of care. And towards this mission, one of the success that we've had is the national scale-up of our TB program, the Nikshay Sati. The tools that you see on this picture on the right side were created by Nora Health. This was launched by Honorable Prime Minister back in 2023. We were awarded the audacious prize, which is the prestigious award, and it reinforces our belief in improving health outcomes and supporting healthcare systems that serve more than 1 billion people. This is the latest, where WHO and Nora Health have signed a collaboration to strengthen support for family caregivers. So there would be a policy document that would be created through this association. And these are some of our stories. I'll come back to our primary topic, Swasth Nari Sashakt Parivar. All these listed, that is all these, Dr. Malhotra has also shared about this, and Dr. Madan as well, where as part of the routine screening, which will be happening in Ayushman Arogya Mandirs and other facilities as well, sub-district hospitals and district hospitals, they're all running campaigns to run this program. We are focusing on all of these through the Care Companion program as well. You can see on the right side where at the Ayushman, these pictures are from ARMS, Ayushman Arogya Mandirs, where the flip charts that have been given to the CHOs in Andhra Pradesh and some of the ASHAs and ANMs in different states are using this. Hence, I'd stop my presentation here, urging that investing in women's health is not just about addressing their individual well-being, it's also about investing in the future of families, communities, and the nation. When women are healthy, empowered, and have access to the resources they need, they can contribute more effectively to the society, creating a positive change. Jai Hind.
Thank you, Dr. Dipali, for that insightful presentation, which has deepened our understanding and added meaningful perspective to today's dialogue. We will now open the floor for questions as due to paucity of time, we have extended. There was some technical glitch in between and the time got extended. Still, I would request participants for patient listening. We are really thankful to you. And if you have any questions, you can post in the chat box or question and answer. And all the participants, they can share their queries and reflections, as this is an opportunity to engage directly with our distinguished speakers and gain deeper insights. I'll just quickly take a couple of questions from our speakers. The first one is for Dr. Malhotra. Dr. Malhotra, from your experience, women and child healthcare, what are the most pressing on-ground challenges that frontline doctors face?
So the first challenge which we all face is that women ignore themselves. And see, like a simple, let me just give you the simplest of diseases of urinary incontinence, leakage of urine. Now, we all know statistically 7 out of 10 women at any age, and especially after 45, will be experiencing this. But they're going to put some dirty extra clothes and all, sit in their rooms, don't come out because the urine smell, socially get isolated. A simple thing, simple treatment, simple medication. Now we have laser treatment and only a chair, electromagnetic chair, they have to come and sit for twice a week to treat this condition, which is debilitating, isolating her. This is the simplest one for perimenopausal age. Then, of course, during pregnancy, the pressure of still producing a male child. I mean, you get pregnant, ladka hoga, ladka hoga, ladka hoga, ladka hoga. Arey baba, ladka. That psychologically and mentally disturbs this lady so much that sometimes, and never, the husband is never coming with her for antenatal care. It's only the mother-in-law. Even the mother is not coming. So she cannot talk in front of a mother-in-law. Mother, as soon as we take her inside to examine, the mother-in-law will say 10 things. Inside, she will take 10 other things. So it's quite, I think we need awareness. Education is there, but empowerment is still not there, as I said. The empowerment and environment has to be still corrected.
Thank you, Dr.
There are
Malhotra.
hundreds of more examples. These were the two simplest one which I say every day.
Thanks for sharing your experience. Definitely, cumulatively, we can contribute to this, and in coming times, the things will improve. Thank you so much, Dr. Malhotra. The next question is for Dr. Bajaj. Sir, do you believe that integrating women's health with family and community health initiatives can shift health-seeking behavior in rural and semi-urban area?
Oh, absolutely. In fact, I think we've seen this firsthand in our Sehat Chopals, which Dr. Malhotra sir also talked about. When we talk to women about their health in the context of their children's nutrition or their family's well-being, I think they are much more open to seeking care. As Dr. Malhotra had said, they put themselves last. So when it is about their children's or their family's well-being, they become much more open. And integrating women's health with family and community health, I think, can shift behavior because it creates a ripple effect. When one woman in a household adopts preventive practices or seeks timely care, it inspires others also in the family, others also in the community, her relatives, her neighbors. So this is the real way to move from episodic treatment to a culture of sustained health-seeking behavioral change in rural and semi-urban India. As Dr. Malhotra, I think, pointed out repeatedly, that once in a year or once in a month is not frequent enough. The population of women in India, if you keep it as a separate country, it will be amongst the most populated countries in the world. And if these community members are not healthy, we will never achieve any SDG goals across the world. So the women of India have to be healthy, have to be empowered to ensure that the women of the world are progressing and the world itself meets the SDG goals that we are aspiring for.
Thank you so much, Dr. Bajaj, for sharing your perspective. And I'm pretty sure with the efforts of all of us and with this campaign at country level, we will definitely do wonders. Thank you so much. The next question, before we call it a day, is the last question that I'll take. Dr. Dipali, it is for you. What role do you see men and boys playing in creating awareness and reducing stigma around women's health issues, such as menstruation and maternal care?
No, absolutely. They have a huge role to play. And I think Dr. Malhotra did, not just saying, ladko ko bhi aapko, samjhana padega. But that's on a lighter note. But even during CCP sessions, right? When we turn these, when we gather all these people, we make sure that men are there. And all our KMC videos, we show, you can see any video, it's all on YouTube, it's open access. All the videos emphasize men doing KMC versus a woman doing that, so that there is reinforced behavior for men to participate, be that voice. As I think Dr. Bajaj also just focused that mother-in-laws are there, who andar aati hain and kuch bolti hain and then bahar chale jate. So there is a disparity, right? And there is no voice for the woman. So then if this man, if he comes to that hospital, if this husband, brother, whoever it is, and we are able to shift their mindset, that will go a long way in creating voice for women in India. And that's what we also promote during our session. So when we train the nurses and we tell them ki ask as much as men possible to come and sit. In some wards you've seen, restricted access and all is there, then we ask them to take session outside. You go out and take only a session for men. Do that. Don't worry about it. And when there are questions, when there are these wards where all the men and women are all sitting and there are these questions, we've also noticed that there's learning from other question and answers. So this is more like a participatory session where a mother or I myself have seen a father-in-law, very intuitively sitting there, and he asked such important questions during the session that also has an inspiring effect on others who are sitting there, right? Or silent observers who didn't participate or thought it's not important for me to participate. Another aspect is our remote engagement service. These phones and smartphones are kahan hai, kiske paas? वो सारे मेल मेंबर्स के पास ही हैं, माओं के पास तो है नहीं. तो अगर हम इनको टारगेट नहीं करेंगे, then it will be very difficult that a mother gets that information. So I can create technology, but I have to take that to her. For breaking that barrier, again, you need your men and boys to be trained. We are definitely, most of our videos, if you see, and I think the latest one is on menstruation, which was brilliantly created by our film team. There also we had participants who were men and boys sitting there, so that this dialogue happens. It is not a taboo, it is something very normal. Your mother, your sister, everyone goes through it, but let's make it normalized. Let's normalize this. Very important for India.
Yeah, thanks. Thank you so much, Dr. Dipali, for sharing your perspective. And it reminds me an ad played by the great actor Akshay Kumar, and he compares that smoking with the sanitary pads. And that's how we are creating such kind of awareness in our community. Thank you so much, everyone. As we draw to a close, let me circle back to where we started. Together for our health, together for a stronger nation. Today's discussion has shown us that improving women's health is not just a medical issue. It is a societal imperative. It requires vision, policy, on-ground commitment, and power of families and communities. On behalf of Ujala Cygnus Healthcare, I extend our heartfelt gratitude to our distinguished speakers, Dr. Bajaj, Dr. Madan Gopal, Dr. Malhotra, Dr. Dipali, for sharing the valuable time, insights, and inspiration with us today. Your contributions have truly enriched this dialogue. We also sincerely thank FICCI for their invaluable partnership and support in making this event possible. A special thanks to Ms. Sarita Chandra for helping us out to constitute this session. And finally, a warm thank you to all the participants, all the patient listeners for joining us in this important mission. Your presence and engagement are what give meaning and strength to our collective efforts. Let us carry forward this momentum so that Swasth Nari truly leads to a Sashakt Parivar and ultimately a healthier, stronger India. Thank you so much, everyone. Jai Hind. Stay tuned for our next webinar next Wednesday, and we will touch base again with you with the information of the next webinar. Thank you so much.
Thank you so much. Thank you, Dr. Vandana. Thank you, Malhotra sir. Thank you, Dr. Dipali. Thank you so much for joining.
Thank you so much, Dr. Bajaj.